Hello everybody, this is DMA FMGE Hacks and we are going to talk about the forensic medicine today. So speaking about the forensic medicine, the very high-yield area or topic of interest of your forensic medicine was your medical-legal aspect of your death, which is a very high-yield topic where you expect to see 50% of your forensic medicine content. And apart from that, remaining the second most area is your injuries, and apart from the injuries you may have to see about the toxicology. So the second most area is abdominal injuries, and the third most area is genitourinary injuries, and then you have the miscellaneous one. So these are the 5 areas you have to remember in terms of your forensic medicine. And speaking of a forensic medicine, you have the 8 things. We divide the forensic medicine into 8 divisions. One is your legal procedure, medical jurisprudence, and you have the forensic thanatology, identification, toxicology, injuries, sexual offense, and forensic psychiatry. Injuries, sexual offense, and forensic psychiatry. So speaking about the legal procedures, so first one is your inquest and medical legal reports, and apart from the court procedures and medical evidence and legal aspect of your medical practice, all of them will be coming under the category of your legal procedures, where you are expected to show your thorough knowledge in this area. Okay. And then you have the medical jurisprudence, so definition, scope, and the history of your medical jurisprudence, and medical negligence and malpractice you have to remember. And then the importance of consent and confidentiality you have to remember. You have to remember the importance of consent, confidentiality, medical negligence, and malpractice. All these things area will be falls into this category. Okay. So again, negligence will be also be like like a criminal negligence, and you have this malpractice and what type of punishment you should be given for the criminal negligence and civil negligence. And apart from that, you have the malpractice you have to remember. So speaking about the forensic thanatology, very important, people. Thanatology means study about death. Study about death. Okay, so in this thanatology you may definitely expect one type of your one question from the thanatology. You can definitely expect a one question from thanatology. So either the time of death or modes of death, whether it is a strangulation or aspiration, or like a hanging or drowning or anything else, or maybe the modes of death and the autopsy and exhumation, autopsy techniques they may expect you in the autopsy techniques will be expected in the FMGE. Techniques will be expected in FMGE, will be expected in FMGE. And then you have this identification. Speaking of identification, identification of living and dead, personal identification marks, and DNA profiling are important. And then you have the toxicology. Speaking about the toxicology, all the poisons and poisoning, post-mortem toxicology, and the alcohol and medical legal aspects are the areas you have to cover. So then you have this injuries, types and classification of injury, whether it is a like a slashing wound, or maybe like it is from the it is a blunt trauma, or what type of wound, and what their medical legal aspects, and then what type of head injury and their medical legal aspects. All those like injuries column you have to remember. And last but no, the very important area here is your sexual offenses. So medical examination in sexual offenses, and then rape and its medical legal aspects, and impotence and sterility are the important ones you have to consider. Legal aspect of your impotence and sterility. And apart from that, forensic psychiatry, like insanity and mental disorder, abnormal practices, and the responsibility and competency, and the criminal profiling are will be very important in terms of your forensic psychiatry. Then you have the other areas where you see the medical negligence, malpractice, time of death, and then insanity and mental disorders, and the criminal profiling. So speaking about the forensic medicine, let's list out the what are the things you have to remember. Forensic medicine, let's list out what are the areas, things you have to remember. If you are very good in remembering, remember the IPCs and CRPCs, and then which we have it in the in your QRS you have the list. And apart from that, the second most area is your thanatology, dissection techniques, I mean autopsy technique, and what type of autopsy is used for what type of thing, and their definition and techniques, all of them are important in the case of your thanatology. And the third most area is your sexual offense. You may expect to see a one question. Sexual offense. And fourth most area is your toxicology, especially your poisons and antidotes. Poisons and antidotes. All of them. This covers 70% of your forensic people. This covers the 70% of your forensic medicine. So you don't need to worry about the forensic medicine. Instead of spending too much time on IPCs and CRPC mugging up, I rather ask you to read the Thanatology. This is a strategic way to remember, secure a 1 mark. So apart from that, there is nothing else. So in the forensic medicine, thank you everyone for watching, and we'll see you with the next subject.